Good afternoon, and thank you for joining us today for the Valiant Payroll Service Affordable Care Act webinar. My name is Robert Schwan. I am the Vice President of Payroll Operations here at Valiant, and I have approximately 20 years of payroll industry experience. My educational background includes an MBA in Business Administration from Long Island University, as well as a CPP, Certified Payroll Professional designation from the American Payroll Association. Joining us today is my partner, Todd. He is the President and CEO of August Benefits. He brings 20 plus years of industry experience, and his educational background includes a BA in International Business, accredited investment fiduciary, chartered financial consultant, registered health underwriter, registered employee benefits consultant, chartered healthcare consultant, and healthcare reform regulations, which is an ACA certification. During today's session, we will be discussing the following topics: the two solutions offered by Valiant Payroll Solutions to ensure your ACA compliance. The first is an enhanced solution, and the second is an ACA basic reporting solution. We will also discuss ACA compliance, reporting requirements, penalties which may be issued by the IRS for non-compliance, and annual forms and filings. We will follow that with a demonstration of the application and dashboard. And then next steps, which would be where you would go to enroll in one of the Valiant solutions. And that will be followed by a question and answer session. We actually have a lot of people on this webinar today, so we will take as many questions as we can. Those questions that are not answered, we'll apologize in advance, but we will follow up with an email that will give you the answers to all your questions. And we'll also share all of the questions with everybody on the webinar. The Affordable Care Act challenges organizations with additional reporting and compliance requirements. The data required to complete the new reporting requirement is a challenge for most employers because this information was traditionally maintained in unconnected systems, including payroll, benefits, HR, and time and attendance. Valiant provides a solution that fully integrates that data needed to ensure compliance and meet your filing requirements. There are two levels of service offered by Valiant. The first option is our enhanced solution. This option is best suited for clients that are looking for a fully integrated application with a quick reference dashboard. In this solution, payroll information flows seamlessly from payroll into your ACA dashboard. The enhanced service solution offers advanced reporting, preparation and filing of your 1094 and 1095 forms at the end of the year, access to the ACA application and dashboard, tax notice resolution, and if you subscribe to Valiant's Employee Self-Service module, your employees will have access to their 1095s as well as their usual W-2 forms on the portal. During implementation, Valiant will gather all employee data. We will also load all payroll information required for your specific measurement period. In some cases, this will require us to go back as far as 2014 and backload the data into the system. Going forward, each time payroll is run, the data will flow to the ACA dashboard, and this will ensure the data is complete and accurate at all times. The second option is our basic ACA compliance tool. This is best suited for those clients looking to extract payroll data in order to merge it with their benefit and HR data. Whether you're doing the compliance in-house or through a third party, this solution gathers the information you need from payroll to be compliant. Standard reporting and ACA reporting tool includes standard reports from the payroll system, and these are primarily used to help determine eligibility as well as full-time equivalent employees. It includes custom alerts, and it includes standard export file. The custom alerts are fully customizable, and they are set up to be initiated according to payroll events. So those payroll events would be when you finalize your payroll, you could have an alert that would tell you this employee was over 30 hours this week, which will help you monitor your variable employees to ensure that you're offering them benefits when it's required. Also very important is what this service does not include. This service does not include filing of your 1094 or 1095 forms. It does not include answering of tax notices, and it does not include a monthly tracking tool or dashboard with your employee data on it. A good note to know, one thing to note is this year with the tax notice comment is that in order to ensure compliance with ACA, everyone is required to have insurance coverage. This can be through their employer, their spouse, or through the exchange. We are expecting the IRS to begin sending notices to individuals and employers regarding proof of coverage. These notices will need to be addressed promptly, and this is included in our enhanced level of service. Yes. Now I would like to introduce Todd Bellistry, who will provide us with the information we need to navigate ACA compliance.
Thank you, Robert. Good
You're
afternoon. First, let's define, before we get into some of the more detailed aspects of the reporting requirements, let's take a moment to define a few basics. First off, the ACA reporting requirement is only applicable for large employers, otherwise known as applicable large employers, or ALEs. An ALE is an employer who employs 50 or more full-time equivalent employees, and the definition of a full-time equivalent employee, essentially, to simplify it, would include any full-time employee who's working 30 or more hours per week. That would count as one full-time equivalent employee, plus the addition of any variable hour or part-time employees by accumulating all of the hours worked by those individuals and coming up with an equivalent full-time individual who would be working 30 hours per week. So I'm assuming most of our attendees today are applicable large employers. If you're not, then of course this ACA reporting does not apply to you. So that's the first basic. Second basic, advance please, is a provision of the ACA regulations known as the employer mandate, also known as the play or pay provision. And what this provision is all about is for applicable large employers, they have a decision to make. Do we want to play the game? Do we want to offer health benefits to our workforce? Or would we rather pay any associated penalties for not playing the game? The play or pay provision. And essentially what this provision entails is it requires ALEs to offer full-time employees, those individuals working 30 hours or more per week, minimum essential health benefits, which provide minimum value coverage and which is affordable. Now the definition of these various terms is a whole other webinar. I can assure you that most group commercial health plans are providing minimum essential coverage. However, the minimum value coverage is definitely a separate determination, as well as the level or whether or not the coverage is affordable for a given employer. So that's a little background regarding ALE definition and the ALE play or pay provision. Next slide. Now, let's talk about this ACA reporting requirements and why do we have these requirements to begin with? Well, the reason these exist is because this is to assist the government in determining if the employer owes penalties for not offering minimum essential coverage, which is minimum value and or affordable, and also to assist the IRS in determining if individuals are eligible for premium tax credits. Now, premium tax credits are credits whereby if an individual purchased health insurance through a given state insurance exchange, that is where those credits would be obtained, and the reporting helps the government track which employees are eligible for those given tax credits. As far as the timing requirement, this reporting begins this year, of course, and effectively beginning January 1st of 2015. What we're doing is looking at calendar year data throughout the course of the year, and that data must be filed on these returns. The returns are forms 1094-C and 1095-C with the IRS, and the deadlines are January 31st for the employee forms. Those would be the 1095-C, and incidentally, that's the same timing requirement as the issuance of W-2 forms. And the IRS submission is due by March 31st if filing electronically, which the Valiant solution will be filing. So that's kind of the timing of how this is all working. Now, something of also related, which we should all be aware of, is that there are other forms, and many of us may have seen these floating about out there, and the other forms are 1094-B and 1095-B. For most employers who have a health insurance plan, those forms are not the responsibility of the employer. Those forms are instead filed by the health insurer, the Oxfords, the Blue Cross Blue Shields, the United Healthcares of the world, and those forms are used to monitor another provision of the law, which is referred to as the individual mandate. Next slide, please. So we have the why and the when. So what must be reported? Well, the forms encompass lots of information. As Robert alluded to, much of this information can be pushed through the payroll system. The information starts initially very basic, identification information of the employer, such as tax ID number, the legal name and address of the employer, as well as a contact name and phone number at the employer if there should be any questions regarding the submission. Then we get into more of the detail regarding the health benefits, if any, which are offered, and there's a certification by each calendar month as to the level of benefits which are offered, the months during the year in which that coverage was available, as well as each full-time employee's share of the lowest cost plan which is offered by the employer, which also provides minimum value coverage. We're also tracking for the forms the number of full-time employees for each month during the year, as well as the number of total employees each month during the year. And those numbers can be different because you have full-timers, and then perhaps we have seasonal employees, or we have part-timers, or we have variable hour employees. So those are all totaled together to give us a total head count for each month during the year. And lastly, we're also identifying the name, address, and social security number of each full-time employee during the calendar year who was offered benefits, if benefits are offered, and also what level of coverage that individual has selected and for what months during the year he or she was enrolled in those benefits. Next slide, please. So with the reporting requirements, I just used a few of the words part-time, variable hour employees, and seasonal employees. Let's take a moment to define these different classifications. This is critical In fact, this is probably one of the most important aspects that an employer needs to make sure they cross their T's on. And it's important because it could save the employer a lot of money, and also it ensures complete compliance documentation. And let's get into some of the details. First off, if an individual is hired as a full-time employee, that is a quite obvious employee. That's someone hired into a position, working full-time, 30 hours or more per week. This individual, this full-time employee, will then be offered health coverage according to the terms of the employer's health plan. For example, full-time employees are eligible for benefits after 30 days of employment. First day of the month following, a full-time employee gets offered health benefits. So that's pretty straightforward. The next classification are the part-time employees. And this is an individual hired into a job where it's reasonably expected that that individual will work less than 30 hours per week. Perhaps this individual is hired for Monday, Wednesday, and Friday shifts, or Thursday, Saturday, and Sunday shifts. Whatever the case may be, that individual is not expected to work 30 hours or more per week. That is a part-time employee. Part-time employees, according to the ACA regulations, are not required to be offered health benefits. So if we can classify our part-time employees, we're saving money by not having to offer benefits to those individuals. Next, we are talking about variable hour employees. And these are individuals at the time of hire. It cannot be reasonably determined if these individuals are expected to work at least 30 hours per week. Their hours vary, thus the term variable hour employees. And for these individuals, we may measure their hours worked over a period of time to determine whether or not we should treat them as full-time employees for purposes of health insurance. Now, why is that so critical? That's critical because for variable hour employees, we do not have to offer health benefits as we would full-time employees after that 30-day waiting period. And I'll get to how we're going to track that in a moment. So that's our third classification, the variable hour employees. And lastly, we have a classification of seasonal employees. These are individuals who are generally working 6 months or less around the same time during the year. They may be treated as variable hour employees for purposes of benefits. And that means we may also measure these individuals over a period of time to determine full-time status. Now, it's important to note that a seasonal employee, when hired for those 6 months or less period, that individual may in fact work 30 hours or more per week. And it may be known that that individual will be working as such. However, we can treat those individuals for purposes of eligibility for benefits as a variable hour employee, thus measure their service over a period of time to determine whether or not we're required to offer full-time status to that individual and thus offer employee health insurance. Now, if our highest concentration of our workforce is in the part-time, variable hour, or seasonal employee classification, I venture to say this is a critical process in the ACA reporting process for any employer that's in this situation. Next slide, please. So how does this measuring work for a variable hour and seasonal employee? We'll try to simplify this in a couple of slides, and then during our demo, we'll give you a little sample flavor of how this would look. So first off, for a variable hour or seasonal employee, when that individual is hired, we're going to start an initial measurement period for that individual. That measurement period can be anywhere from 3 to 12 months from the date of hire outward. And during that measurement period, we're determining whether or not this individual is in fact averaging 30 hours or more per week. Now, it's important to note that during the measurement period, this individual may initially average 40 hours per week. However, if at time of hire, it was not determined that that individual would consistently work 30 plus hours a week, we may classify that individual as a variable hour employee. So we're going to measure that individual during initial measurement period. After that measurement period concludes, we're going to take a little time called the administrative period, and we're going to get our ducks in a row. We may offer benefits to this individual if they've qualified for the 30 hours or more per week during the measurement period. And then we flow into what's called the stability period. The stability period is the longer of 6 months, or the measurement period. And the stability period is the period of time in which that individual will be offered health benefits if they qualified at that 30 hours or more per week during their measurement period. Now, it's important to understand that the stability period is a period of time that the individual is offered enrollment and may stay enrolled during the entire stability period, even if his or her hours drop below the 30 hours or more per week. Very important. Next slide, please. So we're going to give you just a flavor of how this works. We're going to take Tom, and we're going to assume Tom was hired in May of this year. The regulations allow us to begin measuring Tom's measurement period the first day of the month following his hire. So we're going to start Tom's initial measurement period on June 1st. In fact, anybody else who's hired during the month of May along with Tom, we're going to start their measurement period on the same day, June 1st. And that measurement period is going to be June 1st through the following May. We're going to take a 12-month measurement period. During that measurement period, we're going to determine if Tom and any of his other coworkers that were also hired during May average 30 hours or more per week. After that measurement period is completed in May, we're going to take a month or so to have an administrative period to offer Tom and or any of his coworkers health benefits. And then we're going to place them, if applicable, into their own stability period, which would begin on July 1st and go through the following June. It's a 12-month stability period in my example. During that stability period, Tom and any other coworkers would be offered enrollment, and they must be allowed to stay enrolled during the entire following stability period, even if their hours drop below 30 hours per week. Now, here is where this gets complicated. If we go to the next month and we have new hires during the month of June, those initial measurement periods begin July 1st. Any employees hired during the month of July, those initial measurement periods begin August 1st, and so on and so on. So what's going on throughout the course of every single calendar year, we will have 12 initial measurement periods, 12 administrative periods, as well as 12 stability periods. That will occur every single year going forward, if the employer is doing this correctly, of course. Now, once the initial measurement period concludes, if the employer's health plan runs on a calendar year basis, we will then initially drop, or subsequently, drop these new hires into what are called the standard measurement and stability periods, which would be coincided along with the health plan renewal. Next slide, please. As Robert mentioned in his earlier comments, the solution offered by Valiant includes the data feed for the necessary payroll and employee information, and it's important to note that the entire solution is backed and serviced by the Valiant credentialed ACA service team. Our entire team has an intimate understanding and great experience with the various moving parts of ACA, and that's a critical component in making all of this work smoothly, and also to ensure that each employer is in compliance. At this point, I'd like to ask our colleague Arthur Taquino to take a couple of minutes with a dashboard demo, please.
This is the ACA dashboard that is being offered to you today. And this system is designed to do the employee tracking and IRS reporting that was being reviewed today on our slide. So this is the actual user interface that a customer would see when they log in. On the left-hand side of the dashboard is an ongoing compliance checklist, starting with a countdown to the effective date of IRS reporting. Underneath that is a period setup section, letting you know that in fact you have chosen your measurement, administrative, and stability period. And as you can see, you're going to make those selections as discussed for different classifications of employees that you might have, including ongoing and new variable hour employees, just as Todd mentioned. The system also tracks the number of full-time equivalent employees that you have as an employer. Again, this was all covered in the slides, but this helps determine whether or not you are an applicable large employer or AL under the law, and it also relates to specific transition relief that may or may not be available to you. Underneath that is a legend with some additional indicator codes and what they mean within the system. And on the right-hand side is really where all of that tracking that was reviewed in the slides prior to this presentation is really happening. So as the payroll data is being integrated and fed into the system, which is an enormous advantage for you as a customer, it's being processed through the business logic as it's related to these complex regulations. So in Todd's slides, you saw a bunch of graphics about employees and new variable hour, initial measurement periods, and standard measurement periods. All of that is being captured and calculated within this system. So here on the right-hand side, each one of these is an actual report. So if I click on full-time employees, I can see a list of my full-time employees within the system. You can see their location, their department, things like their employment type, are they hourly or salary, their employment date, the actual average weekly hours of service that they're working. And there are two types of full-time employees in our system. There are what we call designated full-time. This is someone, as Todd mentioned, at the time of hire, you know that they're going to be full-time. You know they're going to work 30 or more hours a week, and they are not going to go through this tracking period. We also have calculated full-time people, and this, for example, is someone who did go through either an initial or standard measurement period, worked 30 or more hours a week, and now must be considered full-time for the corresponding stability period. And here, it actually lays out what that stability period is. So when does that stability period start, and when does that stability period end? And for an employer, this is critical information. These are very complex regulations, and what the system does is identify for you, based on the data that's being entered, who is full-time, and then from an IRS reporting perspective, this also will populate the IRS forms correctly based on that information. All of the information in any of these reports can be filtered by the user, so you can get to specific pieces of information. So for example, maybe you wanted to search by a certain location or department, or even just find a specific employee. All of this can then be sent to Excel or printed in the format that you're currently looking at. Now, probably one of the key parts of the system is the tracked employee section. This is anybody who's currently in a measurement period and any point in that measurement period. And as Todd said, that could be and mean that there are 12 different measurement periods, 12 different administrative periods, and 12 different standard or stability periods that are happening throughout the entire year. So here, the critical information that you find in this report as an employer is, where are my employees in the measurement period? So when did their measurement period start and end? What are their average weekly hours of service in real time? So based on the number of hours that they've worked, the number of weeks that have gone by in their measurement period, where do they stand in terms of that 30-hour threshold? And then based on that, what is their projected status? So are we anticipating that they're going to be full-time at the end of this measurement period or non-full-time? And obviously, being full-time or non-full-time has a significant impact on an employer. If they are full-time, You may need to offer them the opportunity to enroll in health care coverage. They can potentially trigger tax liabilities for you, and you must report on these employees. So it's very critical that you know who these employees actually are, and this system programmatically captures that information. So as data feeds in, the calculations are updated, and it keeps track of where these employees are in their tracking, admin, and stability periods for the employer, and also feeds that into the IRS reporting part of the system. So this is filtered just like any other report. You could find anyone who is, let's say, projected to be full-time, for example. You can see when the next measurement period is set to end. So you can see that a standard measurement period is about to end at the end of October with a large number of employees. And this information can then be utilized to determine which employees will become eligible for coverage, essentially, based on the number of hours that they've worked. And you can use that information not only to report accurately, but you can also use this information to help manage hours of service being worked by employees. And you can also use it for practical purposes like budgeting for healthcare costs and practical things like enrolling employees and getting that process started. The system also tracks affordability. Affordability is an actual legal standard under the law, which is very complex and confusing to a lot of employers, and especially their employees. In the past, if you asked an employee, is coverage affordable, it's always going to be a subjective answer based on what they think is affordable. Here, the system captures what the law states about affordability and determines whether or not coverage is being affordable that's being offered to an employee. So you can also identify, is there any employee who's not being offered affordable coverage because they could potentially trigger tax liability for you. And Valiant will play a major role in helping support your knowledge and understanding of all that. They have the right people in place to handle that. There is a comprehensive resource page to help you understand what's going on along with Valiant. So there's information in the system, what are the different definitions we're talking about. Initial measurement period, standard measurement period, what's a stability period. I won't go through too much of this, but this is a breakdown of a lot of the information that's all sort of brand new to employers as they embark on these new complex regulations and compliance challenges. Employers will select the measurement, administrative, and stability period they're going to use. Again, Valiant's going to play a major role in helping assist in that. This is a very difficult decision to make, and there are a lot of different factors that need to be accounted for. This is done in the system, so you choose the length of the measurement period, anywhere between 3 to 12 months, when that measurement period is going to begin, which is also a key factor, and the length of the administrative and stability period. You're going to do this for the different classifications of employees under the law, and then set that in place so that with this information set and with the payroll data being fed into the system, these reports will populate with accurate information and then can be used for reporting purposes. So this is generally the dashboard. There is a standard report as well. Standard report that users can run. We recommend on a monthly basis, in addition to other reports I'm sure Valiant will be applying and supplying you. But this really breaks down some information for the employer regarding which employees are considered full-time at the end of their measurement period, who's in their administrative period, as well as looking forward to the future months of when people's measurement periods end and begin. So for example, here's a report, the month and year it's ran for, what were the measurement, admin, and stability period that we're applying during this time frame, as well as the number of full-time equivalent employees year to date, as well as for the current month. And then here, for example, is a list of all tracked employees whose measurement period ended that month, what their status now is based on their average weekly hours of service. So in essence, who now must be considered full-time by the employer. So this is the ACA dashboard. There's a second piece to the system called Reporting Essentials. This captures much of the data that's here in the system to determine who is full-time. When you talk about reporting, there is a separate piece of information that's very necessary, which is the benefits that are being offered. So this also allows a user to capture information about those benefits. So for example, what plans are being offered, and as Todd mentioned, there's a lot of key terminology you're going to need support on. So for example, is the plan that you're offering minimum essential coverage? Is it minimum value? What are the tiers of coverage that are being offered? These are all directly related to the IRS reporting, and in order to get the forms populated accurately, all of this information will be entered into the system. It'll also allow you to capture census information, which is part of the reporting, and here we're talking about social security numbers as well as their address information, along with the payroll data that's already in the system, and offers of coverage. So for example, was the employee offered coverage? Did they elect that offer of coverage, for example? And so here you can see 2 plans were offered, 1 plan was elected, and you can also identify if you're self-funded, if you have any dependents who are also covered by the plan, which would need to be reported on, again, only if the employer is offering self-funded insurance. But all of this is captured within the system and would help an employer maintain ACA compliance under extremely complex regulations. As you could see from Todd's slides earlier, it's a very fluid situation, where employees are coming in and out of these tracking periods. Offers are going to need to be made at the proper time, and then all of this, it culminates in the actual IRS reporting, which will be due at the end of the 2015 calendar year, moving into 2016. The system is also registered as an e-filer with the IRS, so this system will populate at the end of the year the 1094 and 1095-C forms and submit them to the IRS on behalf of the employer. So I know this has been a high-level overview, and I didn't want to take too much time up in the presentation, but hopefully this gives you a better understanding of how the system is going to practically put in place what both of our speakers have been talking about throughout the presentation on their slides.
Perfect. Thank you very much, Arthur. Okay. So for Valiant offers the 2 solutions that we determined earlier. One is the enhanced level of service, which is your full service ACA compliance tool. And the second level of service is just the basic ACA reporting. If you'd like to find out some more information about either of these 2 solutions, you can absolutely call us. Myself, it's Robert.Schwan, SCHWAN @Valiant.com, or my direct line is 516-224-1964. So in the meantime, what you should do is take a look at your individual payroll requirements and your ACA plans and determine what level of service that you would like Valiant to perform for you. And if you can, please notify us by October 7th of 2015. After this deadline, we cannot guarantee 2015 filings, and that's a soft deadline only because Valiant treats all of our clients as if they're partners, and we will absolutely do everything in our power we can to assist you with anything you need, and that includes your ACA compliance. After that, of course, the clients that are enrolled by the October 7th due date will come first. Anyone enrolling after that period, they will fall in line afterwards. And everyone is challenged with the same offerings because ACA has really become an issue for everybody, so everyone's in the same scenario. The first question is, okay, so what is the general cost of the service? Well, the cost of the service is really dependent upon your individual payroll, your individual payroll counts, and the measurement periods that you pick so that we can determine what level of data that needs to be loaded. So each proposal is going to be on a per client basis, and we're happy to provide that to everyone. The next question that most of us are going to ask is, well, okay, so now how long is that implementation period going to last? When can I have my dashboard, and when can we begin to see this? because as we know, we're already in September, and most people are going to want this in place by the end of the year. With that known, we are going to allow approximately 4 weeks for implementation. That implementation process will include a full discovery where we will specifically look at your data, and then we will do the data gathering on your behalf and with you. As you know, as I mentioned in the earlier slide, not all of the information required to do ACA compliance resides in payroll. So we will need some assistance in gathering the information that's outside of payroll, including your benefit plans and some of the rates, so that we can put all the information together for you in your dashboard. So those 2 questions I'm sure everyone's going to have. Okay, this time we'd like to begin our question and answer portion of the webinar. We have a few questions coming in already. If you'd like to ask a question, you can go ahead and enter that question in on your dashboard, and we will love to answer them. We have a lot of people on the webinar, so again, we will get to as many of them as we can. Any of them that are not answered, we will follow up with an email so that everyone can have the benefit of seeing the questions and the answers that were posed today. One of the first questions that's come in is, can you please confirm the first reporting period timing and data requirements?
Yes.
Okay.
This is Todd, Robert. I can answer that.
Okay.
The first reporting timeline is, as Arthur had mentioned, it is at the end of this year. So the data is for the 2015 year, beginning January 1st, 2015. So this year, we're capturing all of the data, all of the information that Arthur just described in the demonstration. That would actually be captured retroactive to January of this year. And the reporting is fulfilled in the early part of 2016.
Perfect. The next question was, what, if any, are the penalties for not filing timely this year or at all?
I don't mind answering that one as well. The penalties, it's worth noting, by the way, the initial penalty for not filing was $100 per employee return, and that has since been increased to $250 per employee return. So the penalties can be quite hefty. The penalties, thankfully, are capped at only $3 million per employer per year.
Okay. A lot of our clients, especially in the hospitality industry, have multiple EINs under a certain group, and this question relates to that, and it's, how are groups of entities with unique EIN numbers handled for the reporting? Todd, maybe you could take that one as well.
Sure, yep. We have a lot of companies like that. Robert, we've talked about that before, I know, and the way that works is each entity, which is part of that group of entities, will be responsible for their own separate filings. That includes the filings for each employee employed by each entity. And there will be one master, what we call transmittal form. It will be the authoritative transmittal for the group, which is submitted along with all of the other transmittal forms. So one of the entities will be the authoritative transmitter and will encompass all of the forms from all entities.
Todd, if you don't mind, I would just like to add something to that, if that's okay. One of the things that's very complex about a control group, so if you have multiple EINs and you end up ultimately being under the control group rules of the Internal Revenue Code, the law does apply in the sense that each EIN, when determining whether they're an applicable large employer or not, actually has to look at the total number of full-time equivalent employees under the entire group, not just their own EIN. to make that determination, and our system is designed to actually capture that information, so they get set up as a control group. And the other sort of complexity is, while it is the entity, the EIN's responsibility to report their own information, which is absolutely correct, if they have employees, and this is quite common in the hospitality industry, if they have employees who work in multiple EINs who are all part of the same control group. So if you're out there thinking, okay, I have 3 restaurants and I have a waiter who works at all 3 of them, or a waitress who works at all 3 of them, the rules for tracking that employee actually state that the hours that are worked at each EIN within the control group must be aggregated and determined if they are considered a full-time employee, not just based on the hours at one EIN at a time. Our system is also designed to do that, to aggregate those hours and calculate the average weekly hours of service worked in a measurement period. So there are some serious complexities to that an employer who's trying to do that on their own really has very little realistic chance of doing that without a system.
Great. Thank you very much for clarifying. The next question is, would like to confirm that if we have less than 50 full-time employees during the year, do we still need to file a report at the end of the year? And the answer to that is the determination of whether you need to file or not is 50 full-time equivalents. So you need to not only add up your full-time employees, but also your variable and seasonal employees as well to come up with the true number of full-time equivalent employees you have. And then if that number exceeds 50, then you have a filing requirement for 2015. If that number is 45, you do not have a filing requirement for 2015. Okay. Another question just came in regarding the enhanced level of service. The dashboard presentation that you just saw Arthur give is actually for our enhanced level of service. That dashboard is the fully integrated solution that Valiant's offering, which again includes the filing of your 1094 and 1095 forms. It includes the monthly tracking of employees, and includes the full dashboard that you saw on your screen. The second basic model does not include the tracking levels that we described before, as well as any of the filing for 1094 or 1095s toward the end of the year. Okay, maybe Todd, you could take this one. One of the clients is asking when do we really expect penalties to be issued by the IRS or tax corresponding being sent to our employees or the employers in general regarding ACA compliance?
Yes, that's a great question, Robert, and we are expecting the agencies, the IRS in this case, to begin notifying employers of the potential that they may owe a penalty during 2016. Those letters we're expecting will start going out the door, and thankfully one of the provisions of the ACA regulations does allow the employer opportunity to respond to that sort of a notice. So when they get the notice, they don't automatically owe a penalty. They actually have an opportunity to respond, and all of the things we're talking about, tracking, documenting, so on and so forth, this information will be critical for an employer to be able to respond timely and accurately to defend any position they may need to defend.
Perfect. Thank you very much. Another question is, let's see, will Valiant be creating any additional reports that can be ACA specific for those that choose this reporting option? The reporting option is really geared toward giving you the payroll data that is currently housed in payroll. Part of the ACA complexity is that a lot of the information that's required for filing and for compliance does not reside in the payroll system. They reside in many systems: accounting, HR, benefits. So joining all this information, it really becomes a challenge. So if you're looking for an ACA basic solution and you need reports, we do have the standard reports that have been available in the Valiant system for the past probably 18 months, and they're usable and they're accessible every day to all our clientele. If you don't have access to it, you can feel free to contact your payroll specialist, and we'll be happy to run those for you. Thank you very much, everyone. Have a great day. It's always a pleasure to serve you. Valiant is here to help you with all your ACA compliance needs, whatever they may be, and whatever solution you may need. Thank you very much.